Hello, everyone, and thank you so much for listening. I am here today to talk about a law that I helped to pass and the importance of its awareness. A little bit about me. My name is Eva Drennan. I am 16 years old and I am from Hamilton. I'm a junior at Notre Dame High School in Lawrenceville, and I dance, play basketball, volleyball, and I'm in Girl Scouts, and I do a lot of volunteer work. So I'm not busy at all. This is Rocco Gallagher, a happy baby who has an older brother, Colton, and a younger brother, Austin, and two loving parents, Todd and Jennifer Gallagher. Mrs. Gallagher was my science teacher in grade school. She had a normal pregnancy with her first child, Colton, and was excited about learning that she was pregnant with her second child 2 years later. When Mrs. Gallagher went in for her 20-week ultrasound, Rocco's head measurements were off by 2 weeks. It was noted, but not concerning, at the time, as all other markers were fine. Fast forward to when Rocco was born. Everything was normal until he was about 3 months old and he was not resting and constantly needed to be held. He was not hitting his developmental marks and then eventually was tested for congenital CMV and was ultimately diagnosed with microcephaly and cerebral palsy. A little bit about CMV. It presents as a common cold that everyone is bound to get at some point in their life, but there is a higher risk if you get it while pregnant. 50% of adults have had CMV by the time they are 40 years old. Most CMV virus symptoms present as the common cold, fever, chills, fatigue, sore throat, muscle aches, joint pain, and 1 in 3 women who contract while pregnant pass on to their unborn child. 90% of women of childbearing age do not know about CMV or the risk of congenital CMV to their unborn child. And 1 baby out of every 200 babies born has congenital CMV. Risks to baby may include hearing loss, vision loss, mental disability, microcephaly, lack of coordination, cerebral palsy, feeding issues, failure to thrive, sleeping behavior, sensory issues, seizure, death in rare cases, and in Rocco's case, he has nearly all of these. Mrs. Gallagher is a former teacher of mine, and my mom follows her on social media. One day, she was scrolling through, and all of a sudden, she came upon Mrs. Gallagher's post, and it said New Hampshire had just passed a law requiring screenings for CMV. The caption of the post read, "Why can't this be done in New Jersey?" Our immediate reaction was, well, why not? From there, we reached out to Mrs. Gallagher, and she instantly agreed, so we got right to work. I contacted our local legislators and worked with Senators Linda Greenstein and Senator Steve Oraho's office to come up with a bill that could be introduced here in New Jersey. My efforts were documented by my parents on social media, and I was asked to do a TV interview for News 12 CBS News, highlighting my efforts to have the bill crafted. We dropped the bill in June 2021, and in fall of that year, I testified in front of both the Senate and Assembly Committee in support of the bill. The photos here are of Mr. and Mrs. Gallagher, and I testified in front of the Senate Committee and my interviews with News 12 New Jersey. By the end of the 2020-2021 session, the bill was passed unanimously by both houses and signed into law by the governor on January 18, 2022. The law requires all babies born in the state of New Jersey to be tested for CMV shortly after birth. It also requires the New Jersey Department of Education to create educational efforts for expectant mothers on CMV and congenital CMV. This is Rocco today. He is almost 4 years old, is in and out of the hospital, having been admitted 4 times since the beginning of 2023. He is often on oxygen, has had a feeding tube installed, and has recently been diagnosed with chronic lung disease. I'm sure from a parent's perspective, you can only imagine how tough this is, not only for Rocco to handle, but for the entire Gallagher family to handle. No one should have to ever go through this, especially because this is the most preventable congenital disease out there. So, why am I presenting to you today? We need more awareness in New Jersey about CMV and congenital CMV by educating patients about how to prevent it. This virus can be prevented in very simple ways. Don't share saliva with older children. Wash hands often. Don't share toothbrushes. Hopefully, you're not doing that in the first place. And avoid kissing, especially with those older kiddos. I hope that you please just take a moment to look at this from a parent's perspective, as I'm sure most of you are. Think about if Rocco was your son. How would you feel, and how would you want to take action to prevent this from ever happening again? Let's work together and let's help stop CMV. Thank you for your time.